think just to repeat, this is a very serious, unprecedented, massive cyber attack on our healthcare cluster, SingHealth. And I want to take this opportunity to once again apologize to our patients who are affected. And our priority now is to first reach out to these patients, engage them, explain to them, and let them know the status of their information. Secondly, our focus will be on continuing to strengthen our system and look at how we can enhance our cybersecurity. And we cannot assume that the threat has disappeared. We must continue to be vigilant, to continue to monitor our internet activities so that we can detect them early if there is indeed further intrusions. So we must not let our guards down. And the next, we will continue to work with our healthcare clusters and CSA and to support the work of the COI.
If I may compliment what Mr. Gan has said, I think we need to be very clear about what we are dealing with here. We were the subject of a cyber attack. And the perpetrator, as assessed by our agencies, was sophisticated, was targeted, and deliberate in the attack. And I think it is material that the Prime Minister's account was targeted specifically and repeatedly. So first, we need to understand that. The second is quite a bit of data has been misappropriated. So 1.5 million non-medical data. This is the demographic data that was referred to, and also the medication data for 160,000. But we should also bear in mind that the data the data loss did not extend to sensitive data like the clinical data, like doctors' notes and diagnosis and so on. So we have to keep it in perspective. But having said that, every data point and every patient's data is important to us. We cannot take this lightly, and that's why we are responding with the gravity and the seriousness that we have shared with you. We are establishing this committee of inquiry so that we can be thorough in our reviews, and we want to make sure that we leave no stone unturned in learning from this and preventing a similar incident from occurring. But let us also just bear in mind what both Mr. Gan and I said earlier, which is that this is the terrain we are in now when you're talking about the digital era. So we have to gird ourselves for the possibility that there will be such repeated attempts, and our resilience at the system level and as a people is going to be tested from time to time.